ॐ शङ्खं चक्रमुपर्यदश्च करयो दिव्यौषधं दक्षिणे वामे नान्यकरेण संवृतः सुधाकुम्भं जलूकावलीं बिभ्राणकरुणाकर सुखकर सर्वामयध्वंसक सर्वं मे दुरितं चिनत्तु भगवन् धन्वन्तरिं सन्ततम्.
Om Amrita Namaha. So good morning to respected faculty members from different part of colleges from India. So today it's more of a hands-on training program rather than it's not a class. Okay. Just to tell some introduction, just I am here. So we will be, Netra Kriya Kalpa. But here we will discuss Kriya Kalpas not only related with Netra, some of the other Kalpas which will be useful for like Karna Rogas and also for the Nasa Roga and even also for the Shiro Rogas. We have arranged all the demo sections in our Shalakya Kriya Kalpa unit. Just an introduction, just we want to know like what other things are there we are going to discuss today. Just we will see. Moreover, like next slide please. Okay, so in Netra Roga, generally if you see whenever the patients comes with any eye diseases or even ENT related diseases, we have a two set of treatments like Samanya Chikitsa and Vishesha Chikitsa. Samanya Chikitsa like all part of the doctors, Ayurvedic doctors can do. Okay, completing BMS they can go for Samanya Chikitsa. Whenever it comes to the specialization, then only we will look for the specialized doctors like somebody will be having specialization only in Nasa Roga. Nasa Roga in the sense like treating nasal polyp. Only he treats nasal polyp in different aspects. Okay, not going for surgery because here the surgery it's not at all related with here. Treating, giving some medicines and putting some shara and some applications and treating the nasal polyp like that. In Karna also, somebody will be more specialization in CSOM or ASOM, like treating that condition. So like that it comes under the Vishesha Chikitsa. Okay, some conditions we will look for the Panchakarma doctors, we will look for Shalya doctors, we will look for Shalakya doctors. Okay, like that. So here that Samanya Chikitsa and Vishesha Chikitsa is generally classified. Whenever if we see Netra Roga, not only Netra and also the ENT. Samanya Chikitsa means it's a theory only, Nidana Parivarjana and also treating the dosik chikitsas, like with dosas involved, general line of Vata dosha means give Vadahara medicines. Then we will usually we will have the habit of trying. Just when patients come to our OPD, we will give this medicine and we will see. Like then when it's not coming under control only, just usually we will refer in our private practice. Okay, when in conditions like colleges and all, directly if we see, then we have specialization, yes, that we will send it to that. Then we have a keen observation, we have some interest, we will see, okay, this condition is like that, we will also go and see what the doctor is doing like that. So that comes to Vishesha Chikitsa. Here the Vishesha Chikitsa is Kriya Kalpa we will do, and Shastra Karmas also it comes under the Vishesha Chikitsa. So Kriya Kalpa here in Netra there are normally according to the Acharyas, if you say Seka, Aschodana, Anjana, Tarpana, Podapak, everyone will know and everyone has studied in BMS also. So here that is the Kriya Kalpas normally we had been doing. Just next slide. But and Pindi and Bidalaka by Sharangdara Samhita he has explained Pindi and Bidalaka. But apart from that, we can go on adding other kalpas also. Some conditions Aschodana means like putting drops in eyes. Seka means like a dara. What dara you are doing for whole body, we will do it on eyes, that is Sheka. Anjana means application of medicine in the opened eye. And Tarpana also, it's mainly Tarpana here Grita, ghee. Ghee will be used for the eyes, like open and closing the eyes. And Putpaka is Putapaka means it's a Swarasa form. It's like taking the Swarasa. And Pindi and Bidalaka is mainly for the eyelids. Here we can divide this into two categories, like this Aschodana, take Anjan, Tarpana, Purapaka, all these things, the application of medicine for the eyes, open, closing in the eyes. But it is Viralaka and Pindi is for the eyelids. So that is the difference, simple difference. If you go for eyelid treatment, if you like, suppose some insect bites, small insect has been bite, immediately you can take some Bilvadi, Gulika, make it paste and apply for the eyelids. That is comes under Pindi and Viralaka. But if you want to put the medicine into the eyes, so all other things covered. Seka, Aschodana. You can ask, Seka means it's a closed eyes. Now why are you telling that? Seka is a closed eyes, but there also it helps to stimulate the blood vessels. It stimulates the blood vessels, and part of medicine will enter through the muscular structures. So only the Seka is for the eyes. But here there is a condition called traditionally in Kerala, there is a condition called Netra Dara. So Netra Dara, it is a traditional aspect from Kerala. Like that Netra Dara is a condition same like Seka, but it will be done under 2 angular height. 2 angular height it will be done while pouring the medicine. That medicine, in that condition, the patient will open and close the eyes. But Seka is not like opening the eyes at all. According to our Acharya, we follow classically. According to Acharya is telling that we have to, in a closed eyes only, the Seka has to be done. But Netra Dara is little different. We can tell even in a modification form also. Little different from Seka, where we will pour the medicine at the height of 2 angula, where the eyeball will open and close. That is the difference, comes under that Dara. Then Anjana, you know that the application Anjana everyone will be doing mostly daily. Anjana they are putting. Then Tarpana and Pudapaka. Then Vidalaka and Pindi. Vidalaka and Pindi, I told that it is coming for the eyelid disease. Then the other Upakalpas. Upakalpas in the sense we can add other procedures for along with that Kriya Kalpa. Like Nasya. We have to go for if you see take Anjana. Anjana means Suddha Kayasya. Acharya is telling Suddha Kaya. Suddha Kayasya means just we have to clean the body. For that purpose we need Anjana. So it is automatically the Anjana is coming. We have to do the Siro Virachana Nasya. After Nasya only you can follow Anjana. Immediately you can't do Anjana. But not like Seka and Aschodana. Seka and Aschodana, whenever there is no Shodhana therapy, is not necessary. Okay. But in Tarpana, the Shodhana therapy is needed. Again Acharya is telling that you have to go for Shodhana. After Shodhana only you have to follow Tarpana. Okay. So just this Nasya is added. And even like if a Nasya Gandusha, automatically in Nasya procedure the Gandusha will be done. Then like Murdini Tela. Murdini Tela, if you see Murdini Tela, you know that Murdini Tela, Sirovabhyanga, Sirovapicha, Sirodhara and Sirovasa. So here Murdini Tela also helpful in all of the Shalakya Rogas. Even in Karna Rogas we can do, even in Nether Rogas we can do, even suppose like any other condition like Nasa Rogas also. Like based on the condition of the disease, the physician will be choosing which management is needed. So Murdini Taila also helpful in along with the Kriya Kalpa. If suppose the patient is having like a dandruff and like in a common condition, the simple conditions only, only dandruff. Dandruff is there, what we will do, we will give some external oil and rearrange. So that will be only like a Samana Chikitsa. It will be present or it will be like subsides, then again it will reoccur. So if you want to go for Shodhana purpose, then you do the Shodhana, Nasya you do. Then after doing the Nasya, you can go for any, you can choose any Murdini Taila, but in this condition, whenever there is a Darunaka is there, in that condition we have to go for Sirovabhyanga. Sirovabhyanga is nothing but we are applying the oil. Daily we are applying the oil to the head. That is also one type of Sirovabhyanga. Sirovabhyanga is just apply the oil. Then Talam. Talam also we will be doing after Murdini Taila. We will give Talam. Talam we will be knowing. Takradara. Takradara, like it's a Dara where it's a Takradara is mainly we will be choosing this Takradara in Shalakya related conditions, mainly in the diabetic retinopathy conditions. Not only diabetic retinopathy, whenever there is a bleeding disorders like retinal vasculitis is there. Some of the diseases where if you check into the eyes, if the bleeding is there, to bring back the pitta and stambhana property like that, so Takradara will be done. So but this Takradara we need the help of Panchakarma department. So we will again it is like a collaborative work. We will send the refer to the patient to the Panchakarma, then they will choose what is the dosage, everything, and they will do the Takradara. So here, So even Mugabhyanga. Mugabhyanga means just application. Muga lepa. Muga lepa here means it's a lepa. Lepa here, I mean Shalakya, what type of lepa we can apply? Lepa in the sense, suppose like somebody is having sinusitis. So you do nasya. Kapha, accumulated kapha is there, you do nasya. After 7 days of marsha nasya, it may get rectified. Or sometimes again the symptoms is not coming under control. Then you do lepa. But not doing nasya and lepa at a time, it is not advised because Acharya has not told that contraindicated. During nasya, lepa is not to be done. So after completing the nasya, if needed, you can do lepa. So where lepa, or suppose if nasya is, you are not able to perform nasya, you can do lepa only. Like you can take the X-ray and check which type of sinus is affected, whether frontal sinus or maxillary sinus. Over that area, you can put the lepa. Even Padabhyanga, everyone knows. We have studied in when UG, like you have to apply oil to the pada. Okay. So that is like it's stimulating the nerve endings, like just stimulating nerve endings. It's mainly for some bringing clarity of the vision. All these things are, it's not like 1 day, 2 day. You have to continue for 1 month, 2 months. You have to continuously, if you do this procedure, then you may give the results. The results will be seen. Then Avagundana, Netra Pichu. So Avagundana, Netra Pichu and all, like Avagundana is will show that conditions, mainly like if there is any swelling, redness conditions, or like itching. So this Avagundana procedures and all that. So this and all, it's a different Upakalpas. Now Avagundana is there, Muti one condition is there, Muti. It's a one procedure that's told by Ashwani. So this and all, it's based on the disease, this procedure is done. But main Kriya Kalpa will be Seka Sodhanadana, Tatpana Purvak Pinja Nikalata. Along with that, we will be go on adding this type of procedures in Shalak. Then Shastra Karmas, you know that Chedana will be done, Adma Chedana, or like Shastra Karmas like Lekana we can do. If any swelling is there, you can do Lekana. Or if there is any congressions, the patient will be having recurrent itching will be there. So whenever there is itching, if you avoid the eyelid and see, you can see some small white particles, there is a congression. So you have to do Lekana and you have to remove that one. After that, follow with sharp eye wash. Okay. So like then Chedana means like Salesian conditions and like small non-inflammatory swelling over the eyelids. So you have to cut that one and you have to remove the content. So like that. Then Puttanam is mainly like pricking the eyelid margins. Suppose some people will be having falling of eyelashes. So for that condition and all, just only application of medicine will not help. So you have to prick it. Whatever if you are doing in Kalitya like conditions, like Kalitya conditions we will do for Prachana. That same Prachana is called as Puttana for Netra problem. That is the difference. It's very simple. Okay. So what we will do in head, we will do for Prachana from downwards to upward direction. So you do it in the eyes, eyelid margins. If there is a falling of eyelashes, some patients come just to prick it with small needle. Then you apply some Vidalaka procedures. So that will also help. And then Jalukacharna, because Shiravedana, Agnikarma and Sharakarma. Agnikarma is mainly like Agnikarma no need to explain, and Sharakarma also. Agnikarma means like you know that Tokka Agnikarma is there, Tokka Asti, Sandhi Agnikarma. So mainly in Netra, we will go for Tokka Agnikarma. In headache conditions, we will go for Tokka Agnikarma. Then also in glaucoma, it's a common disease nowadays. Everyone will have the familiar glaucoma, raised eye open. So that immediately to bring back the ocular pressure, not a pressure, there is a pain. Ocular pain, we can go for Agnikarma. Then followed by our Netra Kriya Kalpa has to be done. Then Sharakarma mainly in Shalakya, we will go for in nose. It's more famous like terminate hypertrophy. Okay, we have plenty of papers in PubMed also. Whenever there is a nasal blockage, we will be seeing that nasal blockage and we will identify. And normally what we will generally take some mass is there. Some mass is there. That mass also we have to differentiate whether it is a terminate hypertrophy or polyp. Polyp will not be a common condition. Whenever the patient is having a recurrent sinusitis only, they develop a polyp. For long-standing recurrent sinusitis, 1 year, 2 years, like whenever the cold seasons come or rainy seasons come, immediately nasal blockage will be there. Then running nose, sneezing, headache, heaviness of head. So all these are the features of sinusitis. Then recurrently you are getting, give some antibiotics, it will get subside. Then again cold season come, after rainy season, cold season, then again it will get aggravated. Give some antibiotics, it will get subside. So what will happen, frequently you are giving the medicines, there will be thickening of the mucosa. You can go for CT and you can identify that thickening. So that mucosal thickening will be appreciated in the nose in the form of polyp. So that polyp, we have to differentiate. Oh, the patient is having nasal blockage. Nasal blockage is developing due to polyp. So in polyp, what medicine we can do? So what are the medicines? Only Nasya and all will not act in polyp. Nasya will not act. Okay. So you have to go for, because in Ashas, Nasa Ashas, Acharya has told Sharakarma, even Agnikarma also. Ausha Shastra, Shara Agni. Shastra means in polyp there will be recurrence is there in Shastra Karma. So you can go for Sharakarma or even Agnikarma. Agnikarma is more advanced in nasal polyp. Like nowadays we are getting that bipolar cautery. Like it's, you can cautery and we can remove the polyp structures. Okay, that is a pedunculate. It's like a grapes. Simple example, polyp means grapes. One will be hanging. So you have to hold it and you have to cut and you have to cut it. Okay, like that only we can do. But modern science, they do this functional endoscopic sinus surgery. They do enter into the sinus cavity and they will remove all the things. Okay, but the recurrence is more in polyp according to the modern articles. So we perform like Sharakarma. Sharakarma here in terminates. Terminates only Pradishana, Pani Shara and Pradishana Shara we are doing in terminate hypertrophy. Just we have to apply over that wherever there is a the hypertrophy is there, just apply the chara. Then we have to wait for the stipulated period, the time and all it's been told. Then we have to see that shrinking. Then after that we have to just we can clean it or we can apply some grida and honey. Then we have to. That is also here one sitting, like one time you do. It's not. It is also again it is not a healthy. Some patient will be having long-standing polyp or long-standing terminate hypertrophy. You apply chara, one sitting will not help. You can ask the patient to come weekly once, 2 sitting, 4 sitting, 8 sittings. Like some like this polyp condition and all. We do for 3 months. Like 12 sittings and all we are doing. Like every week the patient will come or weekly 2 days the patient will come. Because for the patient, you can ask why they can go for surgery. No, surgery. Yes, surgery is easy. Within 1 day they will do surgery. But the patient those are coming here, they already done 1 time or 2 times surgery. Done surgery again after 1 year recurrence is there. Then again if you go for a modern, they will do surgery. That is the solution. So they don't want to surgery, and another thing is cost also. They have to see. Such things are there. So they comes to us. Then whatever is helpful from our side, we are doing. So when while doing the application of the over the polyp, it's not like completely, it's not like curing. Just to make the nasal cavity free. So patient will not know I'm completely curing. Patient wants relief from the symptoms. That is the thing. We have to do that one. That's all. Just to apply that one, that the polyp mass will come outside. Then the cavity will be free. And then after that the patient will be free. For 6 months there won't be any much. Then again after 6 months there will be recurrence will be there. Again you come, you apply the same medicine. Just do along with this you do nasi also. So this is how the nasal polyp treatment is done. And for the terminal hypertrophy, Shara application is done. Shara application you can do 1 sitting, 2 sittings and all. Not only Apamarga, if you want any other Kadalik Shara is there, Apamarga Shara is there, you have to prepare ourselves and we can do it. So this is the small introduction just I want to share. So all these procedures whatever is possible from our side we will show, demo. If you want you can do also hands-on training also. If you want to do and see also we can do.
Sir, what is Avgundanam?
Yeah, that one we will show all the procedures. Avgundanam is nothing but in Abhishan, there are some conditions like itching in the eyes. Patient comes with itching in the frequently itching will be there. Blepharitis condition is there. Or suppose some watering in the eyes. Okay, like cataract patient, watering in the eyes. So if you tell cataract you have to go to surgery. If you go for surgery, completely watering will not be there, nothing will be there. But some patients I don't want to go for surgery. I will see, I will wait. So So we have to do something. So what we will do, we will give some anti-cataract medicines like L8 or like anything like that. But that will not be much helpful. You have to reduce the watering. For that watering, you do some procedures like Avagunda. Like we are making a kili. All Panchakarma doctors will know what is kili. Big size. Small size is Avagunda. Lemon size. Okay. So big size of Sastishari is a kili. And making that in a lemon size is called as Avagundana procedure. So in that the medicine will be different. You will be putting Navara rice. Here we are putting like a chincha leaves, Rayanda leaves, or like any Nimbapatra leaves. We will put it and we will add little Haridra and we will make it into a kidney form, bolus form, and we will be giving massage over the eyeballs. You will be doing all over the body. We are concentrated more on Shalakya, so we will do on the eyes. Dipping with Kashaya. We are based on the condition. Tripla Kashaya will be there, St Kashaya will be there, Shira Kashaya will be there. Okay. Suppose like patient is having myopia, short sight is there. So we do Tarpana. Okay, Acharya has told Tarpana, so everybody will do myopia means everybody will do Tarpana. So that will not be much helpful. Okay. So we have to analyze in which condition where Tarpana should be done. Okay, what is the reading power and what is the age also. Like patient will be like 30. We will do Tarpana and we will tell I will remove the glasses. No, that's not possible. At the age of 30, putting glasses and we are telling that we will do, that is, I have not seen such. Like if it's like below the age of 50 children, definitely we can make them to remove the glasses. That is also, remove the glasses means, that is also the power also. Like it's -2 or -1. We can rectify that. If -1 is there and the age is like around some 10 years, you do Tarpana 6 months once. And within 1 or 2 years, that -1 will get cured. Completely it will go. So that is okay. It is we can understand that one and it is acceptable. And if you tell the patient is wearing -4 and we are claiming that yes, I will do Tarpana and I will remove the glasses, that is not possible at all. Okay. So this -4 you can tell to the patient further progression will not be there. Okay, because simple myopia will not change into a progressive myopia. Once the progression is occur like -6, -7 and all, it will affect the retina. Stretching of the retina, then retinal pathologies will get developed. So for that purpose, we can tell the patient further progression will not be there. So like while doing this Tarpana, it will get arrested. The progression will get arrested. So the same glasses you can wear till the age of 20. After 20, you can go for LASIK surgery. So what the LASIK people, indication of LASIK, always the power should be constant for 1 year. That is the main indication. If you go and ask the doctor, do LASIK, remove the glasses at the age of 20, yes I will do it. What is the power? -3. Okay. Now -4. No, it's not. So we make that -3 to constantly for 3 years, 4 years. Then we go to the LASIK doctor. The ophthalmologist will tell, oh, -3 for 2 to 3 years, no problem. So that is, the patient also happy. So we also, they come to first, they come at the age of 14, they will come to us to do the Tarpana yearly once, make the power constant for 4 to 5 years. Then if they want, they can go for LASIK, especially ladies, they want to remove the glasses, they can remove the glasses. Okay. So our medicine also helps them. So they will do LASIK and they remove the glasses. So till up to age of 40, no problem. After 40, everybody has to wear the prescribed glasses. There is no. So this is how the treatment is done. So that Sasti Kiri also we are using in Netra. So that water we use.
Sir, is there any treatment for retinitis pigmentosa?
Yes, retinitis pigmentosa also we are doing the treatment, sir. Same protocol only. There is a certain protocol, sir. We have to identify the retinitis pigmentosa, the chronicity. If it is yearly diagnosed, suppose the retinitis pigmentosa is diagnosed at the age of 10. 10 is diagnosed, RP is there. Okay. Usually retinitis pigmentosa, directly the patient will not come to us. First they will go to modern science. It is the only thing. Always they go there, they will come here. Some 70 to 80% of people. Okay. Then they will come all the reports. We have to know what to read that ERG, all such things. Then it is a retinitis pigmentosa. Modern science says no medicine. so they will come to us, then we can start our treatment. So again, we have to start with Shodhana. Shodhana, you are more familiar regarding Snehapana and relation exercises. So we have to do that. Then after that, Shiro Virechana and Nastya also. Then this is one set of protocols. Then we are concentrating on the Stanika Neka. So do Seka. Because first we have to check whether the Amavastha is there or Niramavastha is there. That is very much important in Neka. Amavastha, Lakshanas, we have to leave the Vedam, such things and like that. So we have to check it. Then now it is Niramavastha. Niramavastha is there, we have to do certain things. In first, whenever there is a long-standing disease, definitely there will be a little Amavastha will be there. So to remove the Amavastha, there are certain procedures. Seka, Aschodana, Pindi, only these 4 things should be done in Amavastha. You can't do Tasana in Amavastha. You can't do Purapaka in Amavastha. You can't do Anjana also in Amavastha. Only Amavastha, Seka, Aschodana, Pindi and Vidala. So these things is advisable to do in Amavastha. Then you find that Amavastha is Manda Vedana, all such things. Okay, pain everything is not there. Then you can shift to a Niramavastha condition like Anjana, Tarpana and Purapaka. So here, in retinitis pigmentosa, it is like chronicity is a major disease where till now there is no treatment. Checking the vision, check the fundus, how the retina is there. Then you do the telemetry analysis, how much the optic disc or nerve is getting affected. Then again advanced technology like ERG and all they will do it. Then you can identify, okay, this much is affected the patient. Then we do our treatment, like Seka you can do. Then based on that you can do little Seka Navagunna, 1 or 2 days you do it, remove the Amavastha. Vidalaka also you can add. Vidalaka also. Then that procedure will be initially for 2 to 3 days you have to do that. Then from the 4th day or from the 5th day, you can start with the other conditions like Aschodana. Okay, because Ado Aschodana is the material. So Aschodana you can do. Then shift on to the Tarpana. So here Tarpana again. Tarpana according to the classic, if you see Acharya has told 1 day or 3 days or 5 days or like 5 days once or sometimes daily also they have told all such things. Then in practice what we do maximum 5 days. Sometimes based on the disease condition we can do for 7 days also. Traditionally they are doing for 14 days also. Some practitioners will do 14 days of Tarpana. So based on the disease condition, we can do the treatment. So then after, along with the, before doing Tarpana, we can, in retinitis pigmentosa, Murdini Thaila is very much important. Tarpana after Kriya. So after Tarpana, there is no other treatment. So you have to do all the treatments before only. After Nastya, Seka, Aschodana, you move on to the Murdini Thaila. Here, what type of Murdini Thaila we can choose? Sirobasti. Very good. Sirobasti, because it is Shresha. Sirobasti is Shresha. So you go for the Sirobasti. Sometimes female children they will deny to remove the hairs and all. But Sirobasti means definitely we have to remove the hair. We follow here, there is a strict order from Nambudi sir. Always we will remove the hair whenever we do Sirobasti in our hospital. Some places they will ask him to short the hair. That will not be good. Okay, completely you have to remove the hair and you do the Sirobasti. Then you choose the oil, whichever is Shirabala, Danimar Thaila and all, we can. Then Shirobasti also, for 7 days of Shirobasti we can do. After that, after Shirobasti completely moved in there, then we have to move on to the Tarpana concept. Do the Tarpana, then Purapaka. Purapaka also, 3 days of Purapaka. Here Purapaka again, Acharya has explained Snehana, Lekana, Ropana Purapaka. Here in retinitis pigmentosa, we need more of Snehana type of Purapaka. So this is the protocol. For retinitis pigmentosa, minimum 21 days the patient is needed for treatment. So like you do the treatment, give the internal medications, and after discharge you give some eye drops and the internal medications. After 3 months you can check with the ERG. After 1 month you check the visual acuity. Definitely there will be improvement will be there. Further deterioration of vision will not be there. If 6/60 vision is there, 6/60 is I can see this camera. The patient is having this vision. Then after retinitis pigmentosa, it's one different disease. For 4 years there won't be much problem. 4 years I can see the camera. On the 5th years nothing will be there. That is the retinitis pigmentosa. Okay. Then we can't claim that our treatment work. That is also modern doctors say. Modern doctor will check the ERG and they will tell, yes, Ayurveda treatment is working. There is no change in ERG. No, there is no like that because we get patients from Amrita Institute of Medical Science, Kochi. Gopal sir is the HOD. Sir will study. He will send the patient only for RP, not for other conditions. So we do all the treatment for 2 weeks, Murdin Thaila, Tarpana Purapaka, and 1 month of internal medications. Then every 3 months once he will check the ERG, or 6 months once. And after 3 months he will see the ERG, and if there is any change, he will tell, okay, it's working. Otherwise he will tell, no, it is normal, there is no change in that. Like that. So that is the thing, we have to, in RP, it is, we have to see carefully and we have to give the treatment and identify how the improvement is there also. And if there is a improvement, some patients will get a tunnel vision. Tunnel vision in the sense crossing the road, buses will be coming, they may not be able to see the bus. That is the tunnel vision. So when you widen that field by giving the improvement by our treatment, when you widen that field, that is also a very good improvement. So that will be assessed to the perimetry. Do the perimetry before the treatment, then after treatment, after 1 month, do the perimetry. So you can identify if there is any field vision improvement is there. So that's how we can give the improvement in retinitis pigmentosa. Suppose in retinitis pigmentosa the age of the patient is like 40. They are coming at the age of 40. Already since 15 years the patient is identified disease of retinitis pigmentosa. So what we can do? So the patient will be having a tunnel vision. Okay. Another 5 years the vision will be there. At the age of 50 he will become a blind. That is also, it's not sure that within 5 years the vision will last. That is also nobody knows. It may be remain for another 10 years also. So just on calculation, maybe 5 years complete vision will be. So you give the treatment at the age of 40 and you improve the field vision. So that is also we are showing the improvement. So what is the thing means, definitely the blindness will occur in RP. One thing is we can increase the years. Age of 50 he will become blind. We can increase another 5 years. So that's how the RP treatment is done. We follow this procedure only, sir. Shodhana, Kaya Shodhana.
Some kids developing amblyopia under the age of 5 years.
Yes, sir.
What is the reason and line of treatment?
Yes, amblyopia, lazy eye. Like it will be unilateral, mostly of unilateral conditions, sir. Children will be identified as amblyopia. That is the one thing. What is the thing means? It has to identify. Because in one eye the vision will be 6/6, another eye the vision will be 6/6. If you go and check with the doctor only, you will identify the patient is having amblyopia. It will not be, if nobody will see like this. Always we will see in both eyes. Then the parents has to observe that one. Parents also, okay, my son is seeing, my daughter is seeing, no vision, nothing problem. Sometimes if there is any blurring or sometimes unilateral blurring, it's a very it will not be identified at the age of in smaller age. Suppose if you identified at the age of 5 or 10, then you will take it to the doctor will check and there won't be any much improvement in pinboard, then the doctor will tell it is a lazy eye. So lazy eye, what will be the treatment? Lazy eye, actually there won't be much improvement. But we can do the same Netra Abhyanga, the Kili, Sashi Shali Kili, Tarpana. After Tarpana only, Sashi Shali Kili will be there.
Some kids showing the squint.
Squint will get developed. Yes. In amblyopia patients, squint will get. That is again Jinma, Netra Jinma. Netra Jinma, we can do the treatment like Arjita, Navanam, Mudin, Thailam, Tarpana, Nevacha. So same line of management, Navanam, Nasya has to be done. Murdin Thaila, you do Murdin Thaila, Siro Basti or Siro Dara, then you do Tarpana. After Tarpana, the killing has to be done. Then eye exercise, eye patching. Eye patching is very much important in squint and even amblyopia. If you do all this treatment, that is okay. Then eye patching. Then eye exercise, tossing the ball, looking the objects, distance. It's not a moving object, like one tree or one building you have to look for and look. So in children, school going children, this is difficult, but you have to make it a routine practice. Then after the period of 3 months or 6 months, improvement will be seen. So these things are we are practicing here. So just explain.
Sir, what should be the treatment protocol for diabetic retinopathy and post-COVID ophthalmic complications?
Post-COVID ophthalmic complications. Post-COVID is like if any ophthalmic is there, we will do same like Seka, Pindi Bidalaka only we will do it.
Is there any specific medication for that?
We have Arka preparations. We will go for Arka Astrodhan and eye drops like Nandyavata Arka, like Lodra Arka, Tripla Arka. We will take it in the form of Abhishanda based on the symptoms. After COVID, we will have to get any symptoms in the eyes. Not like this mucormycosis, that is not possible. Any other symptoms like redness is there, itching is there, then we can go for Arka Astrodhan. We give Arka Astrodhana like Tripla Arka Astrodhana because it is widely used in all the type of Abhishanda. In Abhishanda, there is a condition called Ragata, so the everything is there. No? So we will give Arka Astrodhana. If you want to do the treatment, Bidalaka will be done. Seka and Bidalaka will be done.
Sir, for mucormycosis?
I have not seen any cases. Sir. They do not come to
And
us.
sir, for Sjogren's syndrome, recurrent mouth ulcers?
Mouth ulcers we can do it. Sir. We will do Pratisarana. That is a main cause we have to treat. Apart from that, there is after ulcers and all, we do Pratisarana. Like Pitala Churna is there. Or Estimate Churna is very simple. Sir. We can mix it with honey, apply for Pratisarana. Okay, that will be helpful. Then internally Pittavara medicines like Estimate Shirapaka, Drakshadi Kashaya, Dadarasayana tablets, such things and all we can do. So we will go through that.
Glaucoma patient?
Glaucoma. Glaucoma we will check it, madam, whether it's an open angle or closed angle. Okay, open angle means it's like a IOP will be more than 21, 22. But it is a closed angle means it will be like 40, 50 and up. So that is immediately we need a IV mannitol, such things. So in that condition and all, it will be very difficult to manage the closed angle. Because if you are not treating the closed, because you have to always keep in mind there is a standard of care. You should not try. Because if you go to modern, immediately the IOP will come under control. Whether it's possible from our side, we have to check. If you are not doing that one and if you are making the patient to lose the vision, because glaucoma is a very dangerous disease, the vision will go. It is irreversible. It will not come again. So when you check the IOP is 40 or 50 or 60, send to modern doctor. They will give IV mannitol, they will reduce the pressure. They will restore the vision. They will arrest the vision. If you do some Kriya Kalpa and we are telling such things, that vision will go. Next day the vision will go. There is a standard of care is there. You should not try it.
And sir, in mild ways like 20 to 20.
Yes, sir. That one definitely. That one we will do Dara, Shiro Dara we are doing. Then Tarpana we can give. And when you to bring back the IOP like Pindi, and then we are keeping. Then Shodhana medicines internally.